what's in Tom Neuner's future? Like, what does your future look like in chiropractic? What's the next thing on the horizon for you?
Yeah, and that's in Spine Care Partners, and I've been doing that for about 13 years now. And again, we go into payer groups, whether it be an employer or Blue Cross Blue Shield
Mhm.
or whomever, and we train their provider groups on how to work together. So we train the PCP, we train the individual clinicians, we train the surgeons, we train the pharmacy. I mean, what the heck is a chiropractor doing training a pharmacist? Look from their viewpoint. A pharmacist has somebody come in. You've all had, we've all had experience with pharmacy. They fill a prescription and out the door you go. Well, pharmacists are highly trained people who are seeing back pain.
Mm.
What do they do with it? Not everybody needs an opioid, for God's sake. Not everybody needs some type of DME. So we train a pharmacist on self-help for that patient. And then we train the pharmacist, when that fails, that self-help, get them to a hands-on provider. Who are those people? They're chiropractors, they're physical therapists. So by doing that, you've just short-circuited that patient from going to low-value care downstream. We want everything to happen upstream. Educate the patient, get them to see a chiro, and good things happen downstream. That's where we're at. In fact, Vinny, one of the things that we do is when we train those chiros in a provider network, whether it's Blue Cross or an employer network or a state association, wherever it is, we tell the chiros, and this is something our new clinicians can keep in mind, is to physically, you yourself, go and knock on the ACO door in your area. Why? ACOs are a national trend. PCPs, hardly any of them do not belong to an accountable care organization. I sit on the board of one here in Michigan. We have like 400 family docs, and those family docs want to know, who do I send my back pain patients to? 1/5 of my practice that comes in is complaining of musculoskeletal problems. I, as a PCP, have to satisfy these weird things called HEDIS scores. Look it up, HEDIS. HEDIS for low back has certain things they have to satisfy in order to get paid. So they have a financial incentive to use high quality providers. So I'm telling our young clinicians, go introduce yourself to an ACO, ask them what you can do to help, and let them know how you treat people, and show them your treatment plan, show them your data. If you don't have any data, there's plenty of national data you can go out there and Google and get and start that conversation. And I dare say, join that ACO if you can. That group will take care of you if you take care of them.
Yes, awesome.